Also with us this evening, we have Dr. Thomas Marshall. He's the Chief Medical Officer for Alcona Health Center. Another panelist with us this evening is Mike Maturin. He wears many hats, but tonight he is here as a community member. Also with us, Pastor Wayne Ramey from Solid Rock Church of God. Thank you for joining us. We have Dan O'Connor, Superintendent for Alcona Community Schools, and Scott Rice, EMS Director and Emergency Management Coordinator for Alcona County. Thank you all for joining us. We really appreciate it. To get started this evening, we're going to turn it over to Pastor Wayne.
Father, we thank you for the opportunity to gather tonight, Lord. And Father, even though we're at distance, Father, we're together with you. We ask, Lord, that you would be with us and that you would give clarity of mind. And Father, to clear up any misconceptions, Father, that might be out there regarding the vaccine and the COVID. We ask God to make this clear, Father, to open hearts and minds, Father, that we would have a better understanding and that you would be with us and guide and direct everything that's done tonight. We ask this in your name. Amen. Amen.
Thank you very much, Pastor Wayne. Tonight we are going to begin with a presentation from Dr. Marshall, and then we will open it up to your questions. We do have some that we've received ahead of time, so we'll be working those in first.
Good evening. Hi, I'm Tom Marshall. I'm the Medical Director at Alcona Health Center, and we're going to spend a couple of minutes going through a few slides here to help people kind of all get together as far as how the COVID disease came upon us, and also a little bit about how the vaccine and immunizations work in general. So we could go ahead and get started with the first slide, and I'll just sort of follow along with these slides as we go. So the first slide here is basically to try and let us know that this disease of the coronavirus has really been around for quite a long time. It's not new in that the coronavirus causes such illnesses such as the common cold, but every once in a while it rears its ugly head and gives us some problems with much more severe disease. Two episodes in the past that come to mind are the Sars virus epidemic that we had probably about 15 years ago, maybe 20 now, that hit North America pretty hard, especially Canada. At one point, Toronto was shut down because of the Sars virus disease. And it was very much like what we're dealing with now with the COVID disease. In the Middle East, respiratory syndrome, or MERS, occurred and for the most part stayed overseas and wasn't a big factor for us. But unfortunately, in China, about a year and a half ago now, the coronavirus took an ugly turn and presented itself as COVID-19. It comes under a couple different names, COVID-19 or SARS-CoV-2. Both are used to designate this disease. As probably most people have heard, it came from the Hubei province, which is a town called Wuhan, where they first uncovered the virus. It's now believed that most likely the virus started outside Wuhan, but because of a large market there, it turned into a super spreader event, and from that point on, started to spread around the world. And we go to our next slide. So I want to spend just a minute talking about what a vaccine is. I think the most important thing here tonight is to realize a vaccine is only effective for people to get before they get the disease. It's not effective in helping you get over COVID-19 once you've got that disease. So it's important that we get people vaccinated before they get exposed. I would like to spend just a second to try and help people understand how the vaccine works. The human body, when it's faced with a germ or a virus, has a number of ways to react against it. It has killer cells, which go in and attack the virus. It also has memory cells that basically take a photo image of the disease so that if it ever comes around for a second time, your body's ready to fight it off. And this is how the vaccines work. They basically get ahead of the disease we produce a protein that's recognized in the body that looks like the disease, so that when we actually face the disease, the body's ready to fight it off and you don't get sick. That's what makes vaccines work so well. And they've been around for quite a long time. The first vaccine was against polio by Dr. Salk back in the early 50s. And we've been using them safely ever since that time. What's new here is how fast we've been able to develop the vaccine in response to this pandemic. We can go next slide. So the COVID-19 disease is a serious disease. And although up till the time the vaccine was developed, all we really had available was isolation and masks and distancing. And people have taken that and used that very effectively for a while. Now with the vaccine coming out, we have a second tool that we can use to fight off the COVID disease. The more we get people vaccinated, the quicker we can get over this disease, and also the faster that we can get rid of the variant problems that we're running into. As long as the disease smolders, there's constant variants being kicked out from the first disease germ that we had come to our shores. And as you all know now, we've probably got on the order of half a dozen variants kicking around the country. Some of them are worse than the original COVID disease was. So we are on a time crunch here to get this thing stamped out. The longer it sits and smolders, the longer or the more frequent we're going to have these variants come out. There was even a case over in Minnesota where some poor guy had COVID for a long term, like about 2.5 months. And in that time, he alone kicked out 6 different variants from his body. So that's a good example of how if the disease is left to smolder, we're going to see more and more variants popping up. Next slide. So the vaccines are now available in 3 different forms. Most people have heard of most of these at this time, but just to say the names, the first one out was a product made by Pfizer, a second one by Mrna. These vaccines are both very similar. They're known as mRNA vaccines. They work by turning on protein machinery in your cell that makes the protein that looks a lot like the COVID disease. And that's how it recognizes it if you get exposed to the true COVID disease. Those both take 2 shots, and they both need to be about a month apart. The third one that came out was a product called Janssen, made by Johnson & Johnson. This is a 1-shot vaccine, and it's quite effective also. All the vaccines that we have out there take a little time to get going. Once you got the vaccine, it takes about 2 weeks to 3 weeks to start to get the full effect of the vaccine. And that's why, for our purposes, we consider you fully vaccinated only about 2 weeks after you've completed the vaccine, either the 2-course or the single course in the case of Johnson & Johnson. Once you've gone past that 2 weeks, you should be fairly well protected, on the order of 90% or so. Next slide. So as far as how safe the vaccine is, it's important to realize how many steps this vaccine had to go through before it was released. Initially, a small group of people received the trial vaccine, and they did quite well with it and were well protected. After that, they enlarged the number of people who were being tested with to tens of thousands, and they also chose particular groups so that we had good samples of people of different ages, of different races, and different physical health. Next slide. And then after that, they turned their data over to the CDC Advisory Committee on Immunization Practices, who also studied their results, and then finally gave it to the FDA, who took a look at it and took this advice to the advisory committee and finally allowed it to be brought to the market, and is now the vaccine that you're seeing available to all of us. Next slide. So the timeline was speeded up, but there were no shortcuts taken. Basically, the same steps that were used for the same kind of vaccines you get as a child were used in the production of the COVID vaccine. The one thing that was really remarkable is the 4th item on this slide, and that is they had the foresight to get the manufacturing started way ahead of time. It was a bit of a gamble because they weren't sure if it was going to be approved, but once it was approved, the factories are ready to get going, and it was probably one of the biggest time saving steps in the whole process. Next slide. So the question is, can you get COVID-19 from COVID-19 vaccines? Since there really is no COVID disease in the vaccines, you cannot get COVID disease from the virus. That means that you can't catch COVID-19 from the vaccine. And it's important you realize that. Next. Do the COVID-19 vaccines have any side effects? They do have some side effects. For the most part, they're fairly mild. A lot of people have noticed that they get a little bit more of a side effect from the second shot in those cases where there's 2 shots involved. And for the most part, what we've seen is some tiredness, some headache, and a little bit of pain at the injection site. Some people have had some muscle aches and joint pains, chills, nausea, and vomiting, and fever, but those seem to be a little bit less rare than the first 3. And they usually happen in the first couple of days and then settle down after that. And like I said, some people seem to have a little bit more of a reaction on their second shot. Similar case occurs when people have had COVID disease and then decide to get the vaccine after the disease. It's that second dose, either after the first vaccine or after they've had COVID disease, that causes a little bit of increase in the side effect problems. Yes. These next 3 slides basically are pointing out just how well these things were researched. As you can see, with the Pfizer vaccine, they were evaluated in over 43,000 people over 16 years of age in many places throughout the world. And those clinical studies were huge, and they were quite effective, and they were also very exacting. It was very safe, it was very effective, and probably as effective as any vaccine we've ever had. The next slide shows a similar kind of numbers for the Mrna vaccine. Again, this one was only tested to 18 years and above, but had very similar numbers with really great efficacy in eliminating the disease. And finally, the third one, Janssen or Johnson & Johnson, also in 43,000 plus people, again for 18 years old and older, all across the world, also had very good numbers. I would point out that of the 3, only the Pfizer product is one that can be used in 16 to 18-year-olds. The other 2 were 18-year-old and older. Next slide. These are just links that can be looked at who's received the vaccine so far. If you go to the Michigan Department of Health and Human Services website, you can look daily and see how many vaccines have been given out and in which counties. So it's really a handy site to use. Next slide. The vaccine's free. Your taxes paid for it. So it doesn't make any difference if you don't have a driver's license, if you don't have insurance or social security number, everybody can get the vaccine in this country. Next slide. When you get the vaccine, almost every site will offer you the option of enrolling in VSafe. And VSafe is a nice little app that you can put on your smartphone. What it does is it helps follow you as you go through the effects, if there are any, from the shot. The government will ask you daily how you're doing, whether you've got any side effects. You can check off if you had a little fever, or maybe you had a little ache in your arm. And that's the way they can keep track as thousands and thousands of people get the vaccine if it's continuing to show to be safe. One particular area that is really useful for are people who may find out that they're pregnant when they got the vaccine, or perhaps even breastfeeding, because they want to follow that very carefully, since there were no studies done initially on how effective that was and how safe it was. But as people accidentally get this vaccine with those particular conditions, they can find out as time goes on that it is safe. And in fact, that's what we're seeing, is it appears to be very safe in both those situations. Next slide. It usually, as we mentioned, it takes a couple of weeks for the vaccine to build up. If you have COVID disease, it now looks like we've got really strong proof that you're going to be immune from getting the disease again for about 7 months. We expect probably with the vaccines that it'll even go longer than that. Frankly, most of us expect it could go on for years, but again, it depends on the variants that develop in the meantime. Next slide. The reason we wear a mask and continue to do all this stuff at this point is for a couple of reasons. Number one, none of the vaccines are 100% effective. Even if you're 95% effective, that still means 5% of the people who got their vaccines, at least in theory, could get COVID disease, and at least in theory, could walk around and spread the disease. One of the big worries, and one of the things they're looking at very carefully, is whether or not a person who's had the vaccine could get the disease, and even though they don't get sick, they could spread the virus around to people who are near them. It doesn't appear to be a big problem, but it's something they're watching very carefully. And until we hear that it is safe as far as spreading the disease, we still need to wear our masks. Another issue, and that's what we're seeing in Michigan right now, is that there's a huge surge right now in younger folks in the age of mostly 20 to 30 who are rapidly spreading the new variant virus that comes out of the UK. And if we don't wear masks, obviously that's going to move very fast, because that group of people are just becoming eligible to get their vaccines at this time. So that includes a lot of our college folks, a lot of high school kids, and young adults primarily. Next. If you have questions, it's probably best, everybody's got specific and special circumstances. So if you have questions about your vaccine, or if you have any problems with the vaccine after you get it, please talk to your primary care provider. They're probably in the best position to help answer any further questions that may be specific to you. Next. And I'll stop there.
Thank you, Dr. Marshall. We appreciate that presentation. Before I do start opening this up to our questions, I just want to let you know that all questions are meant to be general. We're not looking for specific, to give specific answers about any particular person or case. If you have very specific questions, again, you want to direct that to your primary care provider or a healthcare professional. In a private setting, we're just here to answer general information this evening. So we will go ahead and get started with our questions. The first one that we have here is for Dr. Hammond. And the question is, that Dr. Marshall did talk about this a little bit in his presentation, but the question is, it seemed like these were made very quickly, these vaccines. How do we know that they are safe?
Well, the vaccines are safe, and they're very effective. So the vaccines, you can get COVID from the vaccine because it doesn't contain the virus. And no steps were skipped in making the vaccines. So the process was faster because there was more money thrown at it, and more volunteers and scientists were signed up for it. And rather than waiting for approval to start making the product, they actually made the vaccine as soon as they were ready. And the studies have been absolutely amazing. 95% efficacy, safety data is there. It's very safe. And the side effects, as mentioned, are very minimal side effects.
Thank you very much. We really appreciate your feedback. So the next question that we have will be for Dr. Marshall. Dr. Marshall, the question that came in is it better to get natural immunity over the vaccine? And how can vaccines help with decreasing these mutations?
So I talked about the fact that the mutations are going to keep kicking out for as long as the disease smolders on. So getting the disease extinguished is critical. The longer this thing goes on, and I'm talking worldwide too, we're doing a pretty good job in the United States of getting the vaccine out, but there's many countries where this is just running rampant. And as long as it continues anywhere in the world, we're going to see more and more variants kicking out. And as you can see already, with variants coming out of South America and South Africa, and also the UK, anywhere in the world a variant kicks up, it can take off and come to any other country in the world. So it's critical that we move fast to get the fire put out. As long as it smolders along, we're going to see more and more variants. So that would be the main reason.
Thank you, Dr. Marshall. The next question that we have is for Denise Bryant. Hi, Denise. This is about masks. So this question is about how effective are masks and why should people wear them? I know that was spoken to a little bit in the presentation as well. And what about if they have a vaccine? Do they still need to wear masks? And then I have a follow-up question.
Okay. So I think there's micro actions that everyone can take, and these are incremental steps that prevent the transmission of COVID-19 to others. Masking has been shown to be very effective and beneficial for protecting others. So you're wearing your mask to be a good neighbor to others. It also helps you not touch your own face. And so we know another micro action that people can take is washing their hands frequently. 6 feet distancing is really important as well, and avoiding mass populations whenever possible. So when you take all those small steps together, it will show really effective prevention of COVID transmission. The part where you wanted to ask about why we're masking after vaccine, Dr. Marshall talked about that window period to really boost your immunity. And the other thing is no vaccine is 100% protective. And these actions that everyone can do very easily can help prevent the spread of COVID. And we also just, recognize the surge of the variant. You can look at all the Northeast counties here. It's hitting us. And this is in a really, really important time that we can double down on our efforts and be good neighbors to each other and push for the vaccine. So this is a race against those variants to get people to get their vaccine right now. And the big bang for our buck is all those micro actions that people can take to stop the spread of COVID right now. So that is really, really important. What's your follow-up question?
Actually, now I have two because we have received one from the folks watching at home.
Great.
Can you get sick from wearing a mask too long?
Can you get sick from wearing a mask? Actually, masking has shown a lot of other benefits that we've seen with influenza not spreading this year, and anecdotally, some other people with hay fever and some allergies have talked about their symptoms not being as bad. So I think it is a misnomer or a myth about breathing in carbon or some other issues with this. There is probably a very, very, very small population that would really sincerely have a medical waiver not to wear the mask. And just remember, our healthcare workers have been masking at work for long, long periods of time in our career, and there have been no issues. And that helps me remind everyone to think about our healthcare with donning a mask or avoiding a large family get together for a birthday or something, is because think of those hospital frontline staff counting on you. And every time you can stop the spread, the exponential stop happens as well. It's really quite effective. And so mask up, you actually, it's like a new normal. We will not be wearing these masks forever. Dr. Hamed and I have talked that we wait for that day when we have this vaccine push has been successful. We see our COVID numbers dropping, and there will be that day. And we can't wait in local public health to share when that will be when we hear it. Don't give up.
We have two more questions on masking. So I'm going to go first because I'm anxious to hear your answer. As a visual, is this a correct way to wear a mask?
Your break is a visual coming because there's, like with my mask right here.
So, my point was you have to wear your mask over your mouth and your nose for it to be effective, correct?
Over, yeah, your nose and your mouth. And the better the fit, the more protection that you have with your droplets not going out. So find the mask you're comfortable with, and having the layers can be really important too. And I know mask distributions have happened in every county, and over your nose and mouth. So the improper use of a mask will put people at risk. There's no protection once your nose is not covered.
The last one came in from the internet. Or wash it if you don't have a disposable.
I couldn't hear the whole question. Can you repeat that, please?
So the last question that came in on masking over from our folks watching online was, how often should you change on or wash it if you have a cloth?
It's really important to have good mask hygiene. And so if you have one of the surgical, you know, you should wear it and then discard it properly. We don't want to see these in
Only good
parking
for
lots.
2 hours. Lie.
I don't know what that was, but this is a disposable one and you can wear it for that event, but then you want to just throw it away. And then your material mask should be washed as well. And you should have a different one for every day and have good mask hygiene. And there is more information on the website on that as well.
Thank you, Denise. The next question that we have is for Pastor Wayne Brady. This question is, are there any religious implications with receiving the vaccine or any concerns that you have?
There are no religious implications to against taking the vaccine. There's nowhere in Scripture that there's anything found that says you should not take the vaccine.
I'd like to follow up on that just briefly. As a faithful Catholic, the Catholic Church does have an issue, not with taking the vaccine, but with the way that the vaccine was derived. And what the United States Conference of Catholic Bishops say is that both the Pfizer and the Mrna vaccine are fine. The J&J one is more morally problematic because it was researched and produced using abortion-derived fetal cells. However, what they also say is that the moral implications of not getting the vaccine kind of overweigh that, and so that if the J&J vaccine is the only vaccine available, that it is morally acceptable to get that. However, and there's another caveat, for anyone that decides not to get the vaccine, they have a moral responsibility then to take every measure possible to stop the spread with masking, social distancing, hand washing, all of the things that we've discussed ad nauseum. So for faithful Catholics, we can still get the vaccine. I'm vaccinated myself. But we need to just be aware of the moral implications of how the vaccines were derived. And we should push then for FDA-approved vaccines in the future that don't use abortion-derived fetal cells. So just as a clarification for, yeah, it's okay to get, but we have to be well aware of that. And I also want to say that although my employer is listed on my name tag, I'm speaking as a private citizen today and not as an employee of my organization.
In regards to that, I had done some study today on that, and the vaccine, at least from what I was reading today, the study that I was reading today it is derived using not from the fetal tissue from 1972, but a pattern of that fetal tissue. So it was not actually derived from the fetal tissue from 1972, because I too would stand in agreement with you that if it was derived from fetal tissue, then there would be a biblical reason not to take it, because that is where it was derived from. But after the research that I've done today, that it was not derived directly from, it was used, there was a pattern from that they're using that pattern, but not the fetal tissue itself.
That's correct. And it's the moral problem for the Catholic Church would be that the origin of the derivation, so that we are benefiting from a moral evil. But again, with the caveat that the Catholic Church, as all Christian churches, believe in, and all faiths really believe in the common good. And so the common good outweighs certain things. And so if I choose not to get a vaccine and I don't take the precautions and I get the disease and I spread it to an elderly person or a person who's health compromised or anybody and they die, am I morally culpable for that? And I would argue as a citizen, yes. If I choose not to take precautions and I infect somebody else, I would have some moral culpability for that. Yeah.
And I would just add that going back to the prime directive, and that is almost all of the major churches, at least in America, have all agreed that the first thing you should do is get vaccinated. Number one, and number two, and number three. And then if you have choices and options that don't delay you getting your vaccine, then that's acceptable.
Absolutely.
Anyone else have anything that they would like to add at this time? Okay, we're gonna go back a little bit to vaccines because we did receive a question online. Dr. Marshall, you mentioned that the vaccines were approved by the FDA. Did they hear you correctly?
Yes.
Or is that true?
Yes.
So the approval was the emergency use only, correct?
Yes. As more information comes in and more studies are done, they'll probably remove it from the emergency listing and it'll just become an approved vaccine, just like all our other vaccines.
Thank you. So I did receive a note from our tech crew. They say if people have questions online, they can use the chat function on Zoom to submit those questions. So we do have those that we've already received ahead of time, but you are still able to use the chat function if you want to add another question. The next question is for Dan O'Connor, the superintendent of Alcona Schools. This question is, what is the importance of parents or guardians in screening students for symptoms prior to sending them to school?
That's probably the easiest question I'm going to be able to answer tonight. So it is vital for parents to screen their students before they come to school. You know, we do have temperature checkers at Alcona schools that we use when students come in the building, but you know, we're really relying on parents at this point to, you know, monitor their students' symptoms, err on the side of caution so that we're able to maintain face-to-face learning. We have an employee self-check process as well that we use each day, and just really counting on everybody to kind of stick together to make sure that, you know, we keep people that maybe are not feeling well or showing symptoms of COVID-19 out of school so we can maintain face-to-face learning.
Thank you. The next question that we had come in advance is for Mr. Rice. How is the COVID impacting community or public safety? I wonder, you know, how is it or
your audio is cutting in and out terribly. I didn't get much of the question.
try it again. A question that came in. The question is, how is the COVID-19 pandemic impacting our community as it relates to local police?
We're having some audio difficulty here.
All right, they've made some adjustments. Can you hear me now? Perfect. So again, this is for Mr. Scott Rice. How is the COVID-19 pandemic impacting community safety in regards to our local EMS and police department?
Oh, yep, unmute yourself. We got you, go ahead. Good.
Hear me okay now? Okay, good. It's affecting us tremendously. We have to take extra precautions, extra steps to put our staff into PPE, personal protection equipment, each and every call. We've had to order special equipment for nebulizer and breathing treatments. Gloves, we're going through like crazy. N95 mask are in abundant use. And it takes a toll on our staff as to the preparation to care for that patient for that period of time before we get them transported to the hospital. The other side of the coin is that a lot of our patients we're not transporting in the early phases of COVID-19 because they just weren't sick enough yet. Sometimes it took 2 and 3 evaluations or site visits to get that person to be taken into the ER, and it's because the emergency rooms did not want to be overwhelmed with the lower severity patients. They might have a little shortness of breath, maybe a little bit of cough, but they weren't sick enough, so to speak, to come into the ED. And we were seeing some of those patients 2, 3, and 4 times before they actually got into the hospital. So between the preparation and the PPE and the repetitive cycle, it's taken a big toll on the community.
We thank you for your work. It's very good.
You're still breaking up intermittently.
Hammett, we've kind of talked about this before, but it's kind of asking the question in a little bit different way. Can I get COVID-19 from the vaccine, or can I infect other people once I'm vaccinated?
The vaccines don't contain COVID, so no, you cannot get COVID from a vaccine. And as Dr. Marshall mentioned, the vaccines are not 100% effective, but they are pretty darn good effective, 95% effective. So it is possible to contract COVID once you are vaccinated. And the big question is, can you still spread it, yes or no? Studies out of Israel have shown that it's very unlikely to spread once you are vaccinated. But again, we don't know with certain fact. Real quick though, Ms. Jenny Hart made a comment about masks being good for only 2 hours. That's absolutely false. Absolutely false. You take care of your mask, like surgical mask, you're looking at 8 hours, at least 8 hours use, Jenny Hart. Thank you.
Thank you.
You're welcome.
The next question that we have in the queue is for Denise. The question is, if I was positive for COVID-19, should I still get vaccinated?
Yes, when it's your turn and you can get in. So right now that the gate is open as of April 5th. And if there were some treatments that you had with COVID, there may be a health assessment to delay your vaccine for 90 days. You do have some natural antibodies that you have built up from having the pathogen. The vaccine is recommended though, so everybody should be making this plan. When you present to that provider for your vaccine, there's usually a health assessment form. So the provider will ask you a few questions because we want to make sure everyone getting the vaccine has the opportunity to have their questions answered. And that's a big commitment that we make in our local public health vaccination clinics. So yes, you can get vaccinated, and any specific questions should be directed then towards your personal physician, or public health can assist with some general questions as well.
Thank you. This one is for Dr. Marshall. We've covered this a little bit previously as well, but it is one of the questions that we had in advance. If I am pregnant or breastfeeding, should I receive the vaccine?
Yeah, that's a really good question, and it's a question a lot of people have. The problem is when we first made the vaccines, they didn't include a special group of pregnant women or women who are breastfeeding in particular, as it was for children too. They were in a rush to get it out for adults, and so because of that, we've got very good numbers for the adults, 16 to 18 and older, but we didn't get a lot of really good numbers for pregnant women, breastfeeding women, or children. So at this point, when it first came out, we were pretty hesitant to suggest that the vaccine should be taken in those people. But what we've seen since it's come out is that it appears so far, although not officially, that it appears to be fairly safe in pregnant women and breastfeeding women. And at least so far, it looks like it's going to be fairly effective and safe in children. So we can't say officially until the regulating bodies tell us so. A lot of people are getting vaccines if they think that the risk of getting COVID is greater than any potential risk of getting the vaccine and having a side effect that might bother the baby, for instance. And the other thing that happened is when it first hit New York, a lot of the women physicians in both emergency rooms and ICUs, a lot of them didn't know they were pregnant when they first took their vaccine. And the numbers there have looked very good. There's been virtually no problem with babies. And in fact, it looks like the antibody protection from the mother is moving towards the children in the early stages. So they may get some protection by doing that. So what we're seeing is a gradual migration to getting a more positive attitude to going forward with vaccines for women who are pregnant. And I would also throw out, there was some kind of a early thing about infertility, and that's been, for the most part, totally disproven. It popped up on the internet. There's no fact that I can see. I don't even know where it came from, to be honest, but it keeps floating around. So I would also say that the vaccine has no evidence that it causes any kind of infertility. Of course, if you are anticipating getting pregnant, the best of all would be get your full COVID vaccine before you get pregnant, just to avoid the whole issue. And then you would be protected through your pregnancy as with the baby.
Thank you. And as a follow-up, we're going to pass that over to Dr. Hammond as well. This was the actual follow-up question. Will the vaccine cause issues with fertility? So that was a perfect segue, Dr.
Excuse
Marshall.
me.
Hi, thanks for your question. Actually, as Dr. Marshall mentioned, the vaccines has been shown to be relatively safe. And during the Pfizer study, so to look at studies for drug for trials don't include pregnant women. It's unethical. Okay, so they saw that when in the study, when you said you were pregnant, you were disqualified from the study. However, they saw that for women that initially weren't pregnant, who got pregnant during the study, who got both vaccines, they actually had a higher chance of successful pregnancy, long-term pregnancy, full term, than those who were not vaccinated. So it's absolutely so far proven to be safe in pregnancy and safe in breastfeeding. My sister-in-law who's pregnant just got her vaccine. FYI.
Denise, I've got an easy question for you this time. How much does getting vaccinated cost?
Well, there is no out-of-pocket cost to anyone to get vaccinated. There shouldn't be any barriers in that area. So we don't want anybody to live, work, play, pray, travel into our community and they show up. We will do education and a health assessment, get their informed consent and give them a vaccine.
Go ahead, Dr. Hammond.
Yeah, we just prefer not doing Ohio State Buckeye fans. That's the only caveat.
Awesome. So the next question actually is for Dr. How does COVID-19 affect children?
Yeah, so children who get COVID-19 can have usually a mild illness, such as runny nose, nasal congestion. However, there is a subset of kids who do get pretty sick with this and develop organ and tissue inflammation of hearts, lungs, blood vessels, kidneys, eyes. You know, and a problem that we're seeing, I'm a medical director of an ER and a hospital in the Thumb area, and I'm a practicing ER physician, and we're seeing these kids not get very sick, but we're seeing their parents come to the ER very sick, their grandparents get very sick. So we're seeing these kids don't get very ill, they're positive for COVID. However, those in the household with them, especially the high-risk ones, are coming in very sick.
Thank you. And this is a perfect segue to Mr. O'Connor. What steps are taken when students or staff show symptoms of COVID-19?
So when a student or staff member presents symptoms to COVID-19, they're immediately quarantined and or sent home. So we have a room set aside to utilize, you know, when available or when needed to quarantine students until they're able to get a ride home. We have PPE available for everyone on site that happen to be monitoring those students if needed. But the goal is to get them home and isolated at that point so they can monitor their symptoms and then determine if they need to go, you know, see their provider to be able to determine the next steps. You know, as people have previously stated, I mean, you know, we're more worried about the students taking it home or vice versa and impacting those others. We do see we did not have many challenging cases with students in the fall, but we're starting to see more students become infected recently, which is causing some major complications for the school district and other neighboring schools as well at this point, so very challenging trying to isolate students as soon as possible. We're still having some challenges with families who are awaiting COVID tests and have family members showing symptoms and sending students to school, which is then causing, triggering additional quarantines or additional positives. And it's incredibly challenging time to, and I just want to continue to urge caution from families to try to be able to help us maintain a sense of normalcy and face-to-face.
Looks like Denise has something to add on that.
I just want to really reiterate the partnership that public health has with our schools and with the outstanding job that Dan has done with making decisions for over a year now with protecting schools and families in that community of the school. And that's all the extracurricular activities, the sport and special needs children that are attending. And then there's the staff and the bus drivers and everybody that associated with that school. So I just want to point out what a phenomenal job he does, be it an advocate, be it an informed decision-making person. He has reached out to the health department. We have been able to support him. And I think this community is very blessed that we are well networked and that the problems and challenges with the pandemic, they evolve over time. So just when we figure out how to respond and keep the school safe for this and that, things do evolve rapidly and change. So we've asked all our school workers to be very nimble. And I think we're all bonded in keeping our littles in school. We know that's the best place for them to be. And so there's a big community push to do that. And only as a last resort, are the hybrid or the virtual models being utilized. But the more we have compliance in our community, the easier job it will be for our superintendents.
Thank you, Denise. We have another question that's come in for Scott. You mentioned that your team was having to mask up before a call and take extra precautions. Is this slowing down calls?
No, it's not slowing down our response times. It does take an extra minute or two to fully put on the PPE before we enter into the residence or enter into the area where the patient is. But response times are not affected by this pandemic.
Another question that has just come in for, I guess, really all of you, anyone who wants to weigh in. How do you address people who are hesitant to take the vaccine or say don't trust one over another? What would be your pitch to them to really convince them that this is something that they should do?
I'll take this. I would just recommend talking to your primary care provider because you trust them. You've been with them for ages. They know you. They know all your concerns. Talk to them only. Don't talk to somebody who does this for a daily living who could advise you either way to do it or not do it. Just get reliable medical advice. Don't go onto Facebook. You're going to get misinformation out there. Reliable sources only, please.
A lot of order with my questions here, so bear with me, but that does lead to another one that we had come in earlier. If I can find it. So that question that directly relates to that is, how do you address conspiracy theories or other unproven myths when talking to community members? And this is really for everyone as well. How would you address it if you're hearing somebody pass incorrect information?
Well, I would want to hear what they have to say. I mean, because it's incorrect right now might not mean it's incorrect in the future. So for instance, we know initially steroids were said, don't give steroids in COVID, you're gonna make it worse. Now we see that steroids actually have a role during severe COVID cases, especially in the hospital. So I would want to hear what they have to say and then look at whatever evidence is out there and then help them make an informed decision about why or why not it might be the best treatment out there. But we do know that a lot of the initially thought to be game changers that were already available are not, unfortunately. So that's why following the best medical advice, following what your healthcare provider has to say and what they know is gonna be your best bet. So again, I would just refer only to reliable source information.
I guess I would just add to that, as we get more and more people vaccinated, and as we see more and more people who actually run the gauntlet of having COVID disease, I think if you just check people who are in family or nearby, you'll start to see the reality that the vaccine is very safe. We've given it to millions of people now. They're all walking around, they're upright, they're not getting COVID disease. And the people who've been through COVID will be the first ones to tell you to get your vaccination, get it now, because they've been through it, they experienced it. They do not want that for anyone else. And it is killing people. I think sometimes if we don't have someone in our immediate family who dies of COVID, we think it's not for real. The stuff you're seeing on TV, walking through emergency rooms and ICUs, nurses and doctors exhausted, and that's not fake, that's real news. And I would stick with trusted sources of news, check it out with your own experiences, and then believe it. Don't read what they say on the internet.
I'll add on to that, Dr. Marshall, is that in my ER currently in Sandusky, Michigan, we have four of our hospitals that we transferred to are not accepting any more patients. They're at complete capacity currently. So the thumb is experiencing it. The rest of Michigan is experiencing it too, unfortunately. It's definitely real. You know, and I'll tell people too, is having COVID is not the end of the world. You'll likely survive. We're doing better at treating it now, but there are long-term complications we have to be aware of. So we're seeing a lot of these long hauler symptoms, you know, which are just chronic conditions nowadays, you know, which is unfortunate. But there is a therapy out there that was kind of clouded out by the vaccine. It's the monoclonal antibody therapy, and it does work if you get like within the first 7 to 10 days of having COVID. If you're a high risk patient and you qualify for it, odds are your local hospital carries it in stock, and it's probably sitting on a shelf somewhere because, you know, it's just there. They have it. Ask for it. You might be eligible for it, and it can definitely reverse your chances of getting very sick with COVID. So by all means, there are therapies out there that do work for COVID that are proven. Just be proactive and ask.
And I would add, regarding the conspiracy theories, in order to believe a lot of these conspiracy theories that are running around out there, you would have to believe that millions upon millions of people are conspiring together to do this. And I'm sorry, but the whistle would have been blown a long time ago. People can't keep their mouths shut. So to believe what you're reading on Facebook or whatever, yeah, there's good sources of information out there. But I just lost my brother-in-law this Monday, the Monday after Easter. He had COVID a few months ago. It damaged his lungs so severely that he got an infection and he passed away. I've lost several people in my family to COVID. This is real. People need to start taking this stuff seriously. And because you're putting others at danger. If you choose to ignore it, I guess that's your business, that's your right. But don't put other people's lives in danger because you want to believe some wild, you know, QAnon theory from the internet.
All right. Anyone else have anything to add on that topic? Scott?
Yes. I've talked to some older residents in the county, in the area, and they compare this pandemic to polio, as to in the 50s and the 60s, that this was something new. It was a disease that was not out there before. It was widespread in some areas, and that everybody was fearful of getting it, contracting it, and dying from it. So what was the push? Get the polio vaccine once it became available. A lot of us have that scar on our arm from the polio or the MMR vaccines and stuff, and we lived through that. But some of the older residents in the county, that they're comparing this to kind of the polio scare back in the 50s, that this is serious, this is real. They've lived through many of those things: World War I, World War II, polio, all those kind of things. The younger crowd hasn't done that yet. They've not experienced any sacrifices or any serious widespread diseases, so they don't think it's real. That's all in the past. This isn't going to happen in the future or the current time. That's all in the past. So I think that's where they get some of their theories or their wild ideas at times that it isn't going to happen to me. We're in northern Michigan. It's safe. But it's not true. It's coming. It's been here.
I could add to that too. You know, I work in Metro Detroit. I work on Frankfurt Hospital. And this time last year, we were getting, Metro Detroit was getting hit very hard with COVID. Thankfully, rural Michigan, northern Michigan, some area didn't get that wave that we saw in Detroit. However, after that wave hit Detroit, whoever didn't believe it, believed it. They all knew somebody who died of COVID, who got sick with COVID. So right now, I'm telling you right now, the variants especially, we're experiencing a very hard wave right now. In the thumb particularly right now, we are. We've been shouting it from rooftops for the past month and a half about the variants. It's coming through. It's coming through, and it's a lot more. The younger folks are more at high risk, and my worry is that we're going to have that spread throughout the whole thumb, northeastern Michigan, rest of Michigan too, very frankly, and it's going to cause people to really, if they weren't taking it seriously then, they'll take it seriously now, unfortunately.
Thank you. It looks like Dan had something to add to this.
Well, this conversation turned very serious, and my concern, was more, we're battling a lot of misinformation from the school front too, and people just with significant confusion about whether we're face to face or we're remote or who we're quarantining and why, and we're finding that many people are not going directly to the source; they're going everywhere but to the source, and then misinformation continues to spread, and that is incredibly challenging for us. And that's on a smaller scale probably than the medical community has to deal with on a day-to-day basis. But, I just want to strongly encourage people, as hard as that is sometimes, to pick up the phone or send an email, but try to go to the source of wherever your information is coming from, because you're going to hear the truth one way or the other. And, we want to make sure you have that information so we can continue to stamp out some of the other misinformation that's, occurring. And I think of that from the school front, but I think everyone probably would agree with that on this panel.
Correct. The next question that we have is for Pastor Wayne. What impact have you seen the pandemic have on the community members as far as social and emotional needs? And how do you think vaccination could improve those negative impacts?
I've seen the impact as far as job loss. And with the job loss, the economy has suffered, and you see the number of businesses that have closed throughout the communities and stuff that were, up until this time, they were doing, they were going through the normal business, but now through the COVID, after the COVID has struck, they've lost their jobs, and there's the resources aren't there. And that has taken the effect on the community, and the fact that it's put a bigger burden upon upon those that care for the homeless and those that care for those that are in need, because the need is so much greater now than it was before, and the need has always been there, but now the need has increased.
I have a question for the pastor. Pastor, if you don't mind, I get people that tell me that whatever's fate's going to happen, that God wrote things a certain way, but then God gave us the tools and knowledge to prevent things from getting worse. How do we discuss that with folks so they could look at the size that we have the knowledge now, we're empowered now with knowledge that He gave us to help protect others from this disease? How do we do that effectively?
We just have to reach out and let them know that the seriousness of this, because that like has been said by numerous ones here, the fact that someone knows someone that has passed away because of COVID. So you have to reach out and use the precautions that you can use. And I will say that if my wife and I travel anywhere, we're always masked up, out, but when we're with others, in a smaller group. We're not, we don't always mask in that atmosphere, but because we know who we're with. But as far as if we go out and if we travel anywhere, it's a mask up. It's just getting them to follow along with the guidelines, that it's not a hype. It's not something that, this is not a man-made thing. This is something that's gone on, and diseases and plagues have gone on throughout since mankind has been created. And this is nothing new, but yet there is a cure, and there is, God is not the author of fear or confusion. So we just have to look to him for our strength and seek him for wisdom. If you're in doubt on whether or not you should take the vaccination or not, you should seek him and ask God for guidance in your life, because of the importance of that, because of the fact that it's not just you, but there's others involved. So you need to seek God and ask him, what is best for you? What do I need to do? And go from that point.
And I'd like to add to that just a little bit. I've actually had the discussion with several folks to say, well, God is going to protect me. He's, I have faith in God. He's the healer. And I agree with that 100%. But what we also have to remember is that God asks us to put action to our faith. And so it's not enough to sit back and say, God's going to protect me from this virus. It's use the tools that he has taught our scientists to protect us from this virus. We have to use our heads. It's about faith and reason. And I agree with you 100% that, this has had a devastating effect on homelessness and on hunger. I work in the human services field, and I work specifically with substance use disorder. I'm an educator and a prevention specialist. And so what we've seen throughout this past year is this, because of the isolation, because of all of the fear that's out there, we've seen a tremendous hopelessness and despair, an increase in incidences of depression, suicide, mental illness, domestic violence, child abuse. I just had a discussion today with somebody from CPS that said that the cases that they're seeing now, there are fewer cases, but they're more severe. They're seeing, very severe child abuse cases. Substance use, alcohol, drugs are all skyrocketing, especially among our youth. And so we need to get a hold of this, because if we continue in this, I like to kind of half jokingly call it COVID prison. If the longer we're isolated, we are created by God to be social animals. We have to have relationship. And if we're stuck in our homes by ourselves all day, eventually we begin to despair. And so we need to take the steps necessary. We can get our hope back by doing the right things, by masking up, all the things that we've talked about, getting the vaccine. As this begins to lessen, then we can begin to emerge again and begin to live our normal lives, whatever that may have looked like for us. And so my fear is not so much the disease. I'm vaccinated, my family is vaccinated, but my fear is the other side effects of this pandemic. And that is the hopelessness and despair and the emotional toll, the physical toll that all of these other things are taking on our society. So for that reason alone, we should all be getting vaccinated.
I want to say something else with it. Because I wanted to be totally, upfront and candid, the fact that I myself have not been vaccinated. And for me, it's a personal choice. It's something that I just feel that I can't do right now until I see further data come along. So I don't want to give the impression to everyone that's out there, the fact that, I'm saying this because I have been vaccinated. I have not been vaccinated, but I'm not telling anyone don't become vaccinated because of what I personally feel. This is a personal thing within myself. So I just wanted to make that clear to those that are listening to me.
And again, as the moderator, I guess I would just reiterate that, if you do have questions, if you're not sure, seek those reliable sources, ask your primary care provider. Do the research. Of course, people want more information, and that's part of the reason why we're having this event tonight. We just want to encourage people to look to the right sources. Trust those scientists, their healthcare provider.
And talk to your pastors too. It's
Absolutely.
important to get that spiritual advice for those that are people of faith. Talk to the scientists. Talk to I've known Dr. Marshall for a long time. I trust what he says medically. So we have to get information from all of our sources, and we have to feel right within ourselves to make that personal decision. And that's the beauty about living in America, is that we are free to make those personal decisions. But when we do, we have to still take, like I said earlier, the moral obligation to protect others in any way that we're able to. You're masked up, and that's a good thing.
Yes, I agree.
I guess I would just throw in that the decision to take or not take the vaccine is not an all or none, once or never decision. As every day goes by and more information comes out, you should reassess your issues about whether or not to take the vaccine. I firmly believe, obviously, in my line of work, that the evidence is already there. But if it's not there for you, next week, let's talk about it. The week after that, let's talk about it. Let's talk about it until it makes sense to you that the vaccine's for you. And I think as long as we keep an open mind about it and really look at the facts as they are, use the brain that God gave us, etc. It's a tool that we have. It can save lives. That's all I ask. Think it over.
Dr. Hammond?
I was actually on the fence about the vaccine, so I didn't get vaccinated right away. I was offered it. I did not get it right away. It took me time. I had to do my own homework. Me and my wife kind of went back and forth and debated things, and we agreed I would get vaccinated. We have kids at home. She's a physical therapist. We agreed, okay, I'll get vaccinated. Let's hold off on you for a while to get more data too. So once I built enough confidence for myself, I did get vaccinated. However, I was reluctant to let her get vaccinated until we saw more data, and now she's vaccinated. So it's a matter, just like you said, you have to do your own homework and see what's right for you, and talk to I talked to my healthcare provider about it, and he recommended me to do it because of my line of work and because of my risk factors. So again, everybody is at their own discretion whether to get it or not, but I saw the data, for me at least, was convincing enough for myself, and now my wife got it for herself too. So I just want people to talk to their healthcare professionals, talk to their pastors, get reliable information offline, off the CDC website, the FDA website, and do what you need to do. But it's not a decision for yourself alone, because your decision will help impact others too. But again, if you cannot get the vaccine for whatever reason, then do what you can do to help protect yourself and others too.
Thank you. The next question that we have in the queue is for Dr. Marshall. How should vaccinated parents approach decisions about play dates, going to restaurants and vacations while their children are not vaccinated?
Well, I think that I thought about this since I knew it was coming. Maybe a week or two ago, I was feeling more hopeful. And as a grandparent and needing to see my grandchildren, I got everybody vaccinated as well as I could so that we could see them. We haven't seen them for a year. And so it was tremendous to be able to see them. But if you're sending your kids or your grandkids off to another family, either for a play date or for a situation where you're maybe going to go out to eat, the problem is you really don't know what's at the other end. You don't know whether that family has done the same job you have to protect your family, either by isolation, quarantine, or by vaccination. So it's a bit of a crapshoot, honestly, if you send your kids out to an environment that you're unsure of. Now, if it's a tight family and everybody's been isolated and everything, and you can get together safely, I think that's good. The problem is now that with the variants, it's starting to fly through like wildfire in the younger age groups. And so the very kids who I hoped could get together just a month ago, I really have to say, really shouldn't be going out into those either play dates or going to restaurants. Unfortunately, I hate that that restaurants get dinged about this, but you got to take your mask off to eat. As soon as you take that mask off, especially if you're not vaccinated, you've just opened yourself up to a whole lot of trouble. So for right now, I would say, as tired as we all are, I would recommend not going to the play dates. I'd recommend not eating out at crowded restaurants, or let my kids do that, or my grandkids.
Thank you, Dr. Marshall. Anyone else want to weigh in on that on our panel? Either Denise or Dr. Ahmed?
I'll just say that I echo that. My grandmother lives with my uncle in Ohio in his house, and it's just him and her and his wife. And they had a grandkid come visit them who just went on a play date with one family friend only. He had sniffles, grandma sick with COVID, my uncle sick with COVID, his wife sick with COVID. So no matter how hard you try sometimes, if that bubble's not that tight, then people unknowingly will contract and spread COVID, and it happens. It really does happen. Again, it's nobody's fault. We all try our hardest. We don't blame anybody. We just know there's a variant. So that this variant was a lot more contagious than the previous one, the wild type COVID. So I just recommend people are outdoors, good ventilation, mask, distance. We'll get through this. We just have to be patient and be mindful of others, and I think we'll get through it okay. But it's definitely something we have to look out for.
The next question we actually have in the queue is very similar to this, goes right along with it. Denise, it's for you. Should vaccinated grandparents visit their grandchildren if the children's parents are not vaccinated? Allow other family members to visit children if those other family members are not vaccinated? What we were already talking about.
Yes, I think the one further consideration is the health status of the family members, because some people may have more severe consequences from contracting COVID. And, everything in public health is to prevent premature death. And so families should really be assessing and taking more stringent matters if they have an immune compromised family member. And I think the other thing we see in public health is, my child only had a runny nose or the sniffles, but that's how it's presenting in children right now. And so anybody saying it's sinuses or some sniffles, I think we need to be really vigilant with monitoring or getting a test so that we don't have spread of COVID. The other thing is with our healthy little people, that 40% are likely to be asymptomatic. So you never really know. And so I think families need to make decisions. And I always say, what's the buffet of option choices? Can we do some Zoom or team meetings? Can artwork be sent back and forth? Can, outside venue be implemented for families? So I think I've seen a lot of families get very creative. And I think the pastor was talking about our human connection to each other. And a lot of it is just wanting to make sure everyone in your family is okay. So I think there is a strong desire to connect with your family, but I think every family should make those evaluations of the risks and the benefits and what, kind of prevention strategies they can use to do it as safe as possible.
Thank you. The next question that we have is for Dan O'Connor. Public schools have the power to require vaccinations and vaccines for students to return to class. If the education department requires students to be vaccinated for COVID-19 as a condition to return to school, will Alcona County School follow this requirement?
At that point, that's a pretty simple answer, that we're going to follow the education department's requirements for students to be able to return to school. So if in fact the COVID-19 vaccination is adopted as one of the required vaccines, then that will be part of our process to, readmit students to school or admit new students from there.
And then as a follow-up part of this question, I'm going to give this to you, but I have a feeling that Denise might have some more information on this as well. Is it an option to get a waiver for a vaccine if it does become required? And how do parents do that, get a waiver?
I can't speak to the COVID vaccine and the waiver at this point. It's too early in the game to, probably make that determination, but there are waiver possibilities. And I guess that's a good time to turn it over to Denise and local health officials to kind of, explain what that process might look like.
Being in public health for 26 years, what I know to be true is there's diversity in our community with different faiths, beliefs, background, experiences. And I know that for a fact, nurses and doctors are very trusted entities when we talk about trust for information. So in terms of the public health recommendations for, vaccine, fully vaccinated children, and using NICR to register them. And there has always been a waiver process, and the merit of waiver is informed consent. So there's education, and we honor the family's decision with doing that. So that has always been in place currently. And I think the same thing we're seeing is there's so many different opinions and different places where people are, and it's like a continuum. They move back and forth on different aspects to deal with COVID or some of the decisions in place. And I like to listen, as Dr. Hamed said, to everybody's perspective. There's no cookie cutter. One model is going to fit every person. It actually can be very disingenuous to think that. But we do with anything, whether it was meningitis or pertussis, I make public health recommendations to keep individuals safe and contact safe. And so we're using those strategies now. And the same thing with immunization, it's informed consent. And for our littles in school, our students' parents make those decisions. So it is parental or guardian consent.
Thank you. This ties right in with what we were talking about. What should parents consider before getting their 16 or 17-year-old vaccinated? That's for either Dr. Marshall or Dr. Hamed.
Marshall, do you want this one or?
I mean,
Well,
it
doesn't matter.
Yeah, I mean, as long as it's indicated, especially again, in the light of what's happening now in the state of Michigan, I think that obviously the problem right now for 16 to 18 is that the Pfizer product is the only one that can be used. And that's a bit of a problem for us because of the storage issues. It takes the ultra low freezing to keep it on hand. So it's very difficult for us who work out of offices and stuff to have that product available. But since it is available, we are actually looking at ways of getting that age group vaccinated for those who want to. There's really no reason for them not to, and it may help slow down the rapid spread that we're seeing in the state of Michigan. So 16 and up, all would be totally indicated for getting the vaccine at this point, and I'd highly recommend it.
I agree. I think this is, with the great efficacy of the mRNA vaccines, the Pfizer vaccine especially, I think it's, and with the safety profile I've seen and I've read my homework on, I've read up on, my children are out of age yet for the vaccine, but if it looks like it's safe for their age group, I'm all for it too. And I would never recommend a vaccine I wouldn't put for my own family members' arms. So definitely, if it's safe for my kids, it's safe enough, in my opinion, to other people's kids too. And I'm going to also mention too that there's a big kind of taboo kind of thing around testing. People don't want to be tested for COVID because they don't want what comes with being told you have COVID is isolation and you can't go to school or work. But again, if you have that proof positive PCR test, I have COVID, that's your get out of quarantine card for 90 days if you're exposed. So we have to get people to get tested, number one, to see if they have it so they're not getting other people sick. Number two, if you've had it, get your proof of it and, hey, I need to quarantine again. Look, I got my proof. It sounds stupid to say the vaccine passport, the testing passport. I hate these terms, passport, for the things we should be, but let's go along with it and encourage people to get tested too if they have symptoms or were exposed and are at risk too. Absolutely.
So I'm going to jump ahead a little bit here in my questions because this ties in perfectly. This was for Dr. Hammett. Why should a person stay in quarantine if they have no symptoms?
You know, that's a great question, and I hear it all the time. My own kids ask me that question too every day. I'm like, I told you yesterday, why? So the problem with this, and this is going to be a little complicated to understand, but I have to say this, okay? So when somebody is exposed to COVID, it could go either two ways. They either become symptomatic and they get sick, cough, runny nose, sneezing, or they're asymptomatic without symptoms at all, period, okay? So when they're asymptomatic and so we'll call pre-symptoms and asymptomatic look the exact same. But then one goes into causing symptoms, one doesn't. That period where right before symptoms start, you're super contagious. Your body's spewing the virus, so your viral load is very high, and that's your most contagious time. So sometimes it takes up to 10 days for that to kind of show. So we assume at the 10-day mark, if it hasn't shown, you're doing well, you're not getting sick, you're probably good to go. But before then, unlike the flu, if I expose you to the flu, within 2 days, you're sick of the flu. With this virus, unfortunately, it could take up to 10 days for it to show symptoms. So it's a gamble. You know, you could be pre-symptomatic, but contagious and spreading it, or asymptomatic and not spreading it as much. We don't know. That's why the safe bet is to quarantine and assume, you know, you might be able to spread it if you're exposed. And so long answer, I know, but I just hope it makes sense. It's very hard to explain to even medical professionals too.
Thank you. So the next question we have in our queue, changing modes a little bit, is for Scott Rice. The question is, what can our community do within the community during this current crisis?
I'm sorry, can you repeat the question? You were breaking up a little bit.
So this question is, what can our community do to help others within our community during this current crisis? Was not able to hear me again?
My mic seems to be working pretty good. She's asking what the community could do for each other during the crisis.
Do for each other. Educate each other, educate yourselves, help one another. And by means of whether that mean getting food, supplies, getting them to the doctor, getting them to the vaccine clinic, whatever is necessary to assist the community to get through this pandemic and come out on the other side bigger and better.
I chime in on that.
Absolutely.
Make sure that you check on the seniors that attend your church, or maybe that you don't know, that, you know, maybe not even in your church, but check on the seniors, and maybe they're next door to you. Check on them on a regular basis, because of the fact that sometimes they may not have someone else that's able to check up on them, and we don't want to let them be left alone.
Denise.
So the health department is partnering with different organizations in the community to identify our homebound residents, and we will be able to have nurses or medics actually going into those homes for our seniors that are homebound. So whether the church knows about them or somebody in the community, there will be an ability to call into the health department and let us know, and then we can make a plan to be in that area and give vaccinations to our homebound residents. And I have to point out with our vaccine clinics that we may put 1,000 people through, the amount of volunteers that have volunteered endless hours to support the vaccination efforts in our communities is just really humbling, with all the different levels of support, whether it's watching, you know, helping in the parking lot or giving vaccines, the National Guard coming in. I'm very grateful for every community member that's trying to be of service to others. And that kindness goes so long in terms of really inspiring our staff to keep going who are exhausted. And it really shows in how efficient and effective the community vaccine clinics are running. So I just cannot overemphasize enough that every person can play a very positive part in making our communities healthier. And so also I did want to appreciate all the residents that showed up to get information. Your time is very valuable, and we really enjoy being engaged with people in our community. That is at the core of what public health is all about. So we are grateful.
I'd also like to add on to what Pastor Ramey said as well, as, checking on the seniors, checking on our neighbors, people from our church. I think it's important to provide moral support to one another. This is not a political issue. This is not, we shouldn't be politicizing this whole thing. I had somebody the other day at a local store, just a resident, not an employee, asked me why I was wearing a face diaper. I mean, these derogatory terms that we're using with one another, all we're doing is polarizing each other further and further apart. That's not what we should be doing right now. We should be coming together. That's the only way that we're going to survive this thing, is if we come together, help one another, love one another, find common ground. That doesn't mean we all have to agree on every little thing, but find common ground. And that common ground is the common good of our society.
I would add a number of the churches in the area in particular have gotten together to help food challenged folks. And it's a very difficult time for a lot of people. It takes a lot of guts to go to a food pantry and pick up food when they never have in your life before. But those things are being used, and it's good to see neighbors helping neighbors, running to the grocery store if they're particularly at high risk for them, and then bringing the groceries home or doing pickup type of thing. But I do think the community is supporting itself, and it's really good to see.
It is. The senior center, I'm also the president of the board of directors for the Commission on Aging. And we have a drive up food giveaway twice a month right now. And we have seen just a huge number of people. I agree with you that people that never would have come to a food giveaway before, because people are hurting. And it feels good. I volunteer for it, and we have a large number of volunteers that come out. It not only makes us feel good to help, but it truly is changing lives. And it's good to see churches doing their own food pantries, and the senior center, and I think there's I don't know how many different food pantries popping up in Alcona County. It's a huge number. And I kept thinking as they were popping up, how many of these things do we need? But they're all busy. And so, yeah. And one thing about this community, I moved up from Saginaw about 20 years ago. And I wasn't here too long when somebody's house burned down. And it wasn't 24 hours. And that family had a place to live, had clothes, had pots and pans. This community comes together like no community I've ever seen before. And I want us to do that with this COVID problem as well, because we can get through this.
So piggybacking on that, this question ties in perfectly. It's for Dan O'Connor. What is something the community can do to help educators and students, especially low-income families, who might not have access to proper sanitation or cleaning supplies, masks, or technology for remote learning?
Yeah, I can start with maybe the sanitation or cleaning supplies and masks. I mean, donations are always welcome. At this point, as we're trying to help families and students get what they need, we have a pretty ample supply of masks and different PPE and things to try to assist families. We've had some great community partners that have knitted homemade face coverings for our students 2 or 3 times over at this point. So, a lot of options there. But much like the seniors, I think right now, especially in a case where we're transitioning hopefully for a real short remote stretch here for the next 7 to 10 days, checking in on them and offering some support. It is, I know you can't physically be there, necessarily in some of these cases, but some support for families and educators as they're dealing with another change, and just checking in on people and being there for your neighbors, even if it might not be in that traditional manner. In terms of technology for remote learning, I'm just going to continue to bang the drum for broadband access, and that's nothing new, but we're, as part of our EDC in our county and some different initiatives trying to, get creative. We've got 200 hotspots that we provided students free internet with, during the school year, to do the best we can, and everybody's equipped one-to-one, but even the hotspots don't necessarily work, in our region, and we're running into lots of troubles there as well. So it's it's a multitude of things. And I would just stress to check in on your families, the parents that are now home for the next week or 2 weeks and dealing with 3 students with 3 different schedules, trying to, check in and do different things. I think, just trying to be there for each other is really the biggest thing. And we would appreciate donations on PPE and masks and trying to get those to people that need to have it. And, again, internet access is it's becoming old news at this point, a year later, from last March. But, I feel like we are making some strides, and hopefully we'll continue to do so.
Thank you. Denise, this one is for you, but I'll ask Dr. Hamed and Dr. Marshall to also weigh in. It's safe to travel now. Is it safe to travel with children as well?
So when considering domestic or international travel, the first thing I want to say is sick people should not travel, or any individuals that are known contacts to confirm or even a probable case in the household that may have COVID. You should exclude yourself from your travel plans to be a good neighbor and stop the spread of COVID. I think one thing I found out about our neighbors here is they are really good at researching things. And if you're traveling, the who, what, where, when is all really important, and how you're going to travel. Research ahead of time the restrictions of where you're headed. And with the return plan, think about where you are, and if you get sick, can you be quarantined there 14 days? And what does that mean if you have a pet that you put in the kennel, or you thought something would be taken care of if you got back home? Because there's no guarantees if you're out and about that you would be able to get on a plane or travel if you ended up getting sick. I think I always do an evaluation of the behaviors that create risk versus just the action of traveling. So if somebody got in a car, wore their mask when they're, traveling out of the car and washing their hands and things like that, they may drive to a mountain cabin and their risk isn't any different for them. But the more you're around the crowds, so the airports and large gatherings, if once you get to your destination, then your risk is going to increase. Vaccination does create, especially 2 weeks after completing the vaccination process, does create some safety with that. And I think that, tips coming out from the CDC is that benefit of being vaccinated. I do think the travel international, what I'm hearing is the Americans were the ones excluded from getting into some European countries or Canada because of our case rate. And certainly Michigan, we have more variants and a highest caseload in the nation right now. So there is risk with traveling if you're using mass traveling, but there are things you can do to reduce your risk. And I think the other consideration, if somebody has a history of immune compromise, they need to really evaluate the risks and benefits of traveling as well, because we do see that the state of Michigan, at every airport, they're bringing back testing, like you can get off the plane and have a test before you leave the airport. But the window period is not really screening the last 5-ish days for sure. So you can't rest on your laurels that you didn't get it because you're negative at the airport. And usually a rapid test is a good screening, but it's not the definitive. PCR is, of course, our gold standard. But self-monitoring for symptoms upon returning, and you may need to go into quarantine based on what behaviors at the travel destination you were in or where you were. So I know that with international, there's some quarantine that's recommended as well. So there's a lot to consider with travel. I think the COVID fatigue we see, where people want to get back to a normal life and family vacation and travel, because I think we also heard about depression and activities, wanting normal back. I think it's about making the best choices, the safest choices to get that new normal back. But in order for us to sustain safety in community, we got to do it really in a safe manner. So those are some of my comments on travel. I don't know if the doctors want to weigh in.
Oh, I absolutely echo Denise, what she's saying. I will add on that, by all means, please travel locally. Ideally, support Michigan. So if you want to travel, stay in Michigan. I think it's a great state, obviously. I'm biased. But I do think that depending on your destination, really is how you should proceed as far as behaviors go to. Like you mentioned, Denise, if you go to like a, I guess, remote cabin, it's just you and your family, you're fine. However, the minute you start going to restaurants and stores and people are not distancing, in Michigan, we wear masks. There's a mask mandate. Other states, they don't require that, and that really scares me because we see firsthand what the exposure does. Airplanes itself have very good ventilation. So if you're vaccinated and you need to fly somewhere, if you need to fly, by all means, fly. But make sure you're vaccinated, make sure you wear your mask, and be safe in the airport, especially too. But by all means, I think with the warmer weather now, get out, drive around if you can, go somewhere, please. Just be safe.
Yeah, the only thing I guess I would add is that, when you see recommendations coming from the CDC not to travel, they're faced with the awful task of trying to recommend for the whole country. And slice and dice the country too much, it becomes overwhelming to try and understand what the recommendations are. So pockets of people, their families, for instance, who have all been, they can move around the country a little bit safer now. Add the mask, add the hand washing and the mask, and perhaps without children who obviously would not be vaccinated yet, you can move around to see maybe the grandkids, for instance. But the CDC, faced with the task of recommending for the whole country, can't just say, go fly, basically go travel. But there are groups, I think, that can do that safely depending on circumstances.
We had a question come in from the internet about different variants of COVID, and they would like to know, is there a variant specific to Michigan?
I could jump on that one. Yeah, unfortunately, we're seeing a lot of the B.1.1.7, the UK variant, which is as Denise will tell you, I don't believe data until I actually see it for myself. And when the UK said out there it's more contagious and more deadly, I'm like, okay, thanks UK, we'll do our own homework. And it has been proven to be more contagious and more deadly than the wild type variant that we saw last year. And I believe there is a Brazil variant, P1, identified now in how many counties? Genesee County, I think today reported one. Lapeer County has one as well. Oh, no, that's South African variant. So there's a lot of variants. So the big ones we see right now, the B.1.1.7, there's a P1 Brazil variant and the South African variant too. And all these are said to be more contagious. There is some question whether some evade the immunity from natural immunity versus the vaccine. However, there's more, so we need more data behind that to make a real solid decision. But for now, we have seen studies that some studies that support the vaccine does work against the variants, all the variants so far, and especially the South African variant and the Brazil variant. However, some other studies have shown that your amount of antibodies reduced greatly after being exposed to that variant. So again, I'd wait for more data to come out, but there's definitely a lot of interesting data out there around the world about these variants too. So Michigan is seeing those variants, so we think that's what's fueling the current surge in cases, especially in our areas.
I just add the conundrum with the variants is that, again, we come back to the speed of getting the vaccine out. We know that all the vaccines are at least excellent to moderately excellent for controlling these variants, at least so far. And the faster we put the fire out, the less variants we're going to have to deal with. And I think that's really the critical issue.
Absolutely agree.
I'd like to add, I know that folks here We represent health centers and district health. But I also want to add, anyone looking for a vaccine, if you don't know where to go, Vaccinefinder.org is an excellent place. No matter where you're seeing this from, if you go to that website, you can find a vaccine. And I think we're all on the same page that we don't care where you get it. If you want it, we encourage you to get it right away. All right. Would you believe I'm out of questions? So as closing, I'm going to call on each one of you just to give your final thoughts for the evening. Dan O'Connor, you are on the top of my list, so I'll let you go first.
I'll just keep it short and sweet. We just need everybody to kind of buckle down and double down, as Denise had said earlier tonight, to try to help us get through this second or third wave or whatever wave we're in right now. At this point, it feels like it's been all one tidal wave, but we really need to keep students in class and try to be able to support them and help them navigate this chaotic year. So I just thank the community in advance for helping us navigate these next few months and get ready for an awesome next school year as well.
Thank you. Scott Rice, your last thoughts tonight.
Stay safe, stay vigilant, educate yourself, educate your friends and your family.
Thank you. Pastor Wayne.
Keep the faith. Keep the faith. Keep strong in this. We will overcome and we will make it through. Through this, I can say that, with the number of churches that were shut down and having to go to virtual services, it's something that the church has actually grown because of this in a way that we never thought it could have. And so in this, we need to reach out to those, let them know that, that we will make it through, that God will provide and God will keep you through this. And yes, there are those that will pass because of this, and there was that we know that those that have passed, but yet through this, keep the faith in everything that happens.
Thank you. Mike, your turn.
Well, I would just like to reiterate something that I said earlier, is that we can't let the COVID pandemic further split us apart. Divided, we fall. I mean, united we stand, divided we fall. It's an old saying, but it's 100% true. We need to unite together as a community, as a state, as a nation, and frankly, as a planet, to work together to do the things that's necessary to kind of mitigate the spread of this virus. And if we come together, then not only will we be able to defeat the virus, but we'll find that our community is a better place to live because we've worked together. We've put aside our differences and come together, whether it's a religious difference or a political difference or whatever the differences may be. We need to find that common ground, work for the common good, and use our common sense.
Thanks, Mike. Denise Bryan.
Well, our mission in public health is to be of service to the community, to create health access, health equity, and opportunities for health in every community. I am charged with public health responsibilities in 8 counties. So Northeast Michigan, sometimes we're scrappy on the side of 75. We have learned to be neighborly and to network together. And I think there is a lot of trust that exists among our organizations that have been serving our communities. And I'm very grateful for that. As you can see, I have the privilege of working with very dedicated and knowledgeable colleagues that are part of this town hall tonight. I would be remiss in not thanking my public health staff at both 2 and 4 for their dedication and personal sacrifices for over a year and a half to rise up and provide information and operationalize our epi-tracing as well as our vaccine clinics. And they do that because they're dedicated to the mission and in the health of our community. So I really am privileged to serve in this role. For follow-up questions, we have hotlines at both health departments, and our website also has current information. And I also like to recognize the media that has really focused on providing good information out to our neighbors. They are, so many different organizations have played a valuable part in combating the rise of COVID. And I just think too, there's more common ground that we have than differences. And hang in there is my message, because there will be a day we are able to turn the corner utilizing science and education and public health methodology. And thank you. I think the future, we're going to see our healthcare providers some way, somehow getting vaccine and being able to be in the fight against COVID in a more active manner. So new information and things evolve quickly with this pandemic. So stay tuned. A couple of weeks, we'll be going in, I'm sure, a strengthened position as well.
Thank you, Denise. Dr. Hammond?
Thanks for inviting me on this meeting tonight. It was a lot of fun. It was very informative. I just want to tell everybody to, be strong, be mindful of each other. We'll get through this. We have to be realistic about what's going on. These next few weeks will be very critical weeks, very critical to what direction this goes. And by even being on this Zoom meeting tonight is a big step to hopefully keep everybody safe and healthy. Support your local hospital, support your health department. They are rock stars. I brag about DHD2 all the time. Their ears supposed to ring constantly. They are my vaccination heroes. They are literally lifesavers. I can't speak highly enough of them. They're just amazing people. So support public health and keep faith and pray to God every night. We'll get through this okay. We will get through this. We have to really work together, and we have to get out of our comfort zones and be ready to really re-energize with the momentum we had last spring. Let's bring it to this spring and just really go at it full force. I think we'll be okay.
Thank you. Dr. Marshall?
Yeah, thanks for the opportunity to talk to everybody. I guess my prime goal is to make everybody aware that the vaccine is truly a modern medical miracle, to take advantage of it. This is just truly amazing that this country was able to come up with other countries to come up with such a tool to actually head this thing off. I also want to thank everybody in our clinics, our nurses, staff, and the providers who've really gone out of their way to add fighting the virus on top of all the other work they do to try and get it out to the community. And the community's responded well. And people have gotten the vaccine and they've done well. There's been very few side effects and virtually no contraindications. And if you have any doubts, talk to your provider. I'll guarantee most of them have already gotten a shot and they can tell you exactly how it went. Mine was easy. I didn't even feel the first one. The second one is a little bit tired for 24 hours. And that was it. And I feel good now that I'm a month out, that I'm protected and my family's protected. Thanks.
Well, thank you all very much for participating. A big round of applause for our panelists. Those of you at home who joined us, I really appreciate it. Again, if you do have any follow-up questions, feel free to reach out to your primary care provider or your health department or your local community health center. They're all there to answer any questions that you have. Thank you so much for joining us tonight.